head of audiology of Bayfields Opticians, Paul Jackson, pointed out one unexpected warning sign of high blood pressure: tinnitus. Tinnitus is described as any noise you can hear that's not in the environment, Jackson explained. Some people experience a ringing, while some hear more of static-type sound. Others hear noises that are more like music, and others experience a constant droning. Jackson pointed out that tinnitus is perceived differently by every patient. The condition is unrelated to hearing loss, but it could signal high blood pressure or a brain tumor. If you think you're experiencing tinnitus, you should speak to a health professional to get a diagnosis to rule out any other health conditions, Jackson advised. High blood pressure, the exercise to avoid or risk hypertension, expert issues warning signs of high blood pressure. The Mayo Clinic highlighted a few warning signs of high blood pressure. This includes headaches, shortness of breath, nosebleeds. What is high blood pressure? The NHS pointed out that a reading above 140/90ths of a millimeter of mercury is considered high blood pressure. Risk factors include age. The risk of developing high blood pressure increases as you get older. A family history of high blood pressure. The condition seems to run in families being of Afro-Caribbean or South Asian origin. High-fat diet, high amount of salt in your diet, lack of exercise, being overweight, smoking, excessive alcohol consumption, stress. Diabetes and kidney disease have also been linked to high blood pressure. Don't miss Jane Danson Health, the star's tragic health admission: "I knew something wasn't right, Insight cancer, signs you should never ignore, thousands risking their lives," warns NHS chief. Insight, the popular supplements linked to higher risk of hospitalization. Expert issues warning: tips, for an accurate diagnosis, you need to have regular blood pressure checkups. This can be done at home with a blood pressure monitor, at a pharmacy, or at a doctor's practice. Bear in mind that some people might have elevated blood pressure readings at the doctor's clinic. This is because feelings of anxiety or stress when you visit your GP can interfere with your blood pressure reading. This is referred to as white coat syndrome, which is why taking regular blood pressure readings can be helpful. Your doctor may give you a blood pressure device to monitor your readings at home. This strategy helps to identify whether you're suffering from white coat syndrome or if your blood pressure really is elevated. The dangers of high blood pressure: high blood pressure can lead to cardiovascular disease, and can result in strokes, heart attacks, blood clots, aneurysms. Treating high blood pressure: if you've established you have elevated or high blood pressure, how can you reduce your reading? The NHS recommend regular exercise of at least 30 minutes a day. Activities can include walking, cycling, or swimming to help bring down your blood pressure in the long term. Other lifestyle measures include losing weight, eating a healthy diet, and restricting your caffeine consumption.